Month, KX News reported that the current amount of medical marijuana patients is way behind what was projected when the law passed 2 years ago.
And one family says that could be in part because it's difficult to find a doctor to sign the required certification that would allow patients to apply for a medical marijuana card.
New this morning, Becky Farr spoke with a couple who say the struggle to find a doctor stands in the way of finding relief for chronic pain that's been ongoing for more than a decade. Becky?
Tim and Alicia, I met with a woman who told me that a misdiagnosis she later learned was Lyme disease has left her with pain so bad that she barely has any motor function. When medical marijuana was legalized in North Dakota, she thought that would help her until she started hitting walls when it came to finding a doctor to sign her certification to apply. She didn't want to be on camera, but her husband speaks out on the frustration.
You'd go and get it easier on the streets than, going through this, but that makes you a criminal then.
Dwayne's wife, Ava, has had intensifying chronic pain since 2009, making her almost completely dependent on her husband. "I'm practically a prisoner of my house," she said.
We're trying to get it, and it seems like the legislation has been dragging their feet and making it harder and harder for people to get it. And my wife has read books on it, and it seems like something that she should be able to at least try to get some relief from her pain.
Ava is a patient at CHI St. Alexius, which has a policy where they will not sign off on medical marijuana for their patients. That leaves it up to her to take the time to essentially doctor shop. But because she has an existing medical provider, she said her insurance won't cover those appointments, making it a trying and expensive search. "What am I supposed to do?" she said. "I'm practically trapped." And it appears that she's not the only one.
We've heard from individuals that call in and may inform us that, well, my healthcare provider won't sign it.
Provider concerns could be for many reasons. One in particular has been voiced at the legislature about the language in the certification that requires doctors to attest their professional opinion that the patient would in fact benefit from medical marijuana. House Bill 1417 would remove that language. It's been passed in the House and is moving on to the Senate.
The change made to the certification by the House of Representatives certainly would alleviate certain concerns we've heard from the medical community.
And perhaps it could help Ava, but she would still be tasked with looking for doctors. She and her husband feel that there should be an easier way of finding doctors willing to sign the certification. The law says that the state cannot provide a list of doctors who are willing to certify a medical marijuana application. However, that does not stop medical providers from advertising or making it known to the public that they're willing to sign off on it. Tim and Alicia, Jason Wall told me that he's heard similar stories from other states about doctors being apprehensive at first, and that the Medical Marijuana Division is working on education for healthcare providers to hopefully get more on board.
Yeah, well, you hope that her medical woes can come to an end soon. So
yeah,
we'll keep tracking this story. Thanks, Becky.